There's no way you are going into my spine, putting 2 rods and 4 screws into my vertebrae, putting in a disc replacement, and then you're gonna send me home that day. It was mind-boggling to think about, but it ended up being an outpatient surgery. It was crazy. As a kid, super active. I played multiple sports. Baseball was definitely my love, but I played football, I played soccer, I played basketball. About my senior year in high school, I started progressively getting some chronic pain in my lower back. We weren't really entirely sure where it came from, but it started turning my life into a sedentary lifestyle. And anybody who knows me knows that that's not who I am.
When I first met Greg, he had been dealing with back pain for several years, had been able to manage it. And in fact, we both decided that surgery was probably not the right answer right now.
We did multiple things to try to make sure that the pain was reduced. We tried medication, we tried physical therapy, we tried a radial ablation, which reduces the pain, but all of those things were Band-Aids. Eventually the pain came back, and so the conversation shifted from how do we maintain to how do we fix. I mean, I was at the time 42 years old. I didn't want to have a fusion in my back because you hear a lot of horror stories about once you do the fusion, you're done for. But eventually it got to the point where I just couldn't handle it anymore. And so I elected to do the surgery, and it was probably the best decision I've ever done. He explained the procedure pretty much to a T. He told me what they were going to be doing. He told me where they were going to kind of go in through the different spots on my body and my back. He showed me x-rays. He showed me MRIs. He showed me why a permanent solution would be better than continuing to try to maintain. He explained to me what would happen if I didn't do the surgery. He wanted to make sure that I was super comfortable in terms of what was happening within my body to get me back to the point where I could continue living my life how I wanted to live. And that's kind of where I felt comfortable when he recommended doing the surgery. Then he goes, yeah, this will be an outpatient. You don't have to be in the hospital. I'm like, there's no way. No way. But they did it. And I mean, it was awesome.
95% of what we do in spine surgery is aimed at getting people back to what they like to do or out of pain. Our primary goal is to get to that endpoint as quickly as we can.
Oftentimes, to the contrary, an outpatient surgery is actually safer for the patient.
This approach allows for patients to have a faster recovery, return to work faster.
Treatment options include minimally invasive surgery, and this is in the form of either using robotics, navigation, all of which are to provide the patient with the best surgical outcome.
Spine surgery is all about precision. We're working with very delicate nerves.
We want to make sure that when you're putting something in there, it's going where you want it to go.
We're working with millimeters of precision here.
We can use a robot, a microscope, everything that you'd find in sort of a hospital setting we have here in the surgery center.
And ultimately, the leapfrog distinction puts us at the top echelon of surgery centers.
What it means is that we're meeting certain metrics that are not met throughout the whole country because these awards and recognitions are not given out everywhere.
It is not just about the surgeon. It's not just about the surgery. It's about how we get people ready for surgery, through the day of surgery, and how we follow up with them afterwards.
I attribute this to our entire care team here and their dedication and their passion to providing the most innovative and safe procedures here on an outpatient basis.
They're oftentimes pleasantly surprised once the surgery is done and their pain is better, and they're sitting in the recovery area and they finally say, hey, this wasn't so bad.
I was less than an hour removed from surgery and waking up from the anesthesia, and they were already getting me out of bed. But just sitting up and getting out of bed, knowing that there's all this hardware in my back now, made me kind of get to the feeling of like, maybe this was the right decision. Maybe this is going to be the best thing for me. Being able to be home to rest and recuperate without other people being around, it was absolutely amazing. But even still, like while I was at home physically, the surgical center was completely connected to me at all times. They constantly calling, constantly checking in, constantly doing those things. So I had the peace of mind to be at home. I had the comfort to be in my own bed, but I still had the care that they were giving me while I was at home.
When you have this type of procedure done, we put some limitations on you for the first 4 to 6 weeks, but then after that, pretty much let you get back to what you like to do.
His exact words, Dr. McConjie's words, were, you can do what you want to do. My buddies planned a ski trip, and I was like, I don't really ski anymore. I was super nervous about getting back on the skis, but also falling. So they planned this trip sort of to push me a little bit more to say, if you're clear to do this and you're okay to do this, let's get over this together. I went down, we were skiing and we were doing that, and the inevitable happened. I took a pretty good fall It was one of those that you kind of hope somebody had a video of. It was, you're spinning and there's snow everywhere and I lost a ski. And that was the one thing that I was worried about. Next thing I know, I'm getting myself up, I'm putting my ski back on, and I'm getting myself back down the hill. And I got back on the ski lift and I continued our trip. I think that was a huge thing for me because I took on quite an impact and nothing happened. That would have set me aside for 2 weeks. But after the surgery, that was something that allowed me to just get back out there. And so I'm proud of myself for that, but I'm also thankful to my friends for forcing me to go do that, because that was yet another hurdle that I had to get over to really say, like, yeah, I'm back. You get one life to live, right? So why not live it how you want to live it?